Welcome to the Voice of Business podcast. We're once again here at Bennett's. A big thanks to them for providing the space, and Janice at Odixki Media for producing this. And Lori Richey, the Healthcare Advancement Coordinator for the County of Peterborough. Thanks for joining me today.
Thank you for having me.
Yeah, and we are talking physician recruitment. So, latest stat I saw, 2.3 million people in Ontario without a doctor. I forget the figure for what it's projected in the next couple of years, but it is a much larger.
1 in 4.
One in 4.
By 2026.
Wow. Okay. And so how are we here in Peterborough? Are we above, below?
I would say we're probably at the 1 in 4 right now. They're projected right now that it's around 30,000. So if we look at our population between city and county, that is about 1 in 4. Projected for that to double. So Peterborough is not in great shape for a number of reasons.
Yeah. And when we say Peterborough, we're talking city, county, we're talking
correct.
Regional.
Talking the broader.
Okay.
Yeah.
Now I've seen a couple announcements recently out of Norwood. I'm a resident out there, and I've seen what they've done. They've got a new healthcare center, and they've attracted a couple of doctors. What strategy seems to be working out there, and is that something that can be replicated in other areas in the region?
Well, Norwood, in consultation with their residents of the community, determined that lack of primary health care was a number one priority for everybody. As we know, you need a primary care provider to actually gain access to the health system for a number of other things. And so they set about a plan of making that happen for their residents. And they did that. And they worked with a local contractor, and they built a new medical facility. And then they created an environment in which made it a really nice place for a physician to come and practice. So they are taking over kind of the business component for the physician, managing the staff, and also providing free rent for the facility. And overhead is one of the biggest barriers for a physician, primary care physician at this time, because it's upwards of 30% of their revenue goes to overhead. And so they created a very, very attractive environment in which for physicians to practice. And it's certainly been extremely successful. And they have recruited 3, and they're looking to recruit a 4th. Wow. And, I would have to say within 12 to 18 months, I think every person in Ashfordale Norwood who does want a primary care provider will have one.
Wow. That's a great success story.
It is a great success story, but it also comes with some controversy because, traditionally healthcare has not been a municipal responsibility. Yeah. And so this is changing that landscape and putting pressure upon other municipalities within the county. Healthcare really is a provincial and a federal responsibility, but unfortunately they've dropped the ball there. So, this township has done what they need to do, and it definitely is working for that community. Yeah.
No, and I hear this from municipalities on a lot of things, right? Like it tends to be the catch-all of whatever issue, whether we're talking about addictions and mental health issues in our community and homelessness. And there are areas where municipalities, they deal with housing, they deal with a couple of these things, but we've become that part that sort of catches up on all the things that are falling through the cracks of the provincial and federal government or that they simply just don't want to, be the leaders on.
That's right. So part of my role is to work on lobbying for changes for that, and obviously using my municipal politicians to help, make the province understand, that we can't incur this burden at the municipal level, that the taxpayers are already, we're taxed through every means possible. So, and
on that lobbying side of things, I think it's an issue that unites almost every group, right? Like regardless of the political spectrum. As Chambers of Commerce, deal with my colleagues across Ontario, and it's a constantly recurring topic. I talk to businesses. People don't always realize it's see it as necessarily a business issue, but when I've got businesses that are struggling with lost time, if a employee does not have access to a family doctor, the amount of time that goes into waiting in a merge to deal with minor issues or just lower health within their employees. But the biggest one is labor mobility. If somebody is on the fence about whether or not they want to relocate to Peterborough, housing isn't as cheap as they thought it would be, there's all these things, and then, I'm going to have to leave my family doctor. Or I have ones that have relocated here, but their family doctor's still in Brampton.
Yeah, absolutely. Absolutely. That is a 100% valid point, not just even labor mobility, but new businesses establishing within our communities would be hesitant to do so if their employees can't get primary care.
Yeah.
You're absolutely right. It does create backlogs within employment. But the other side of that coin is now they're looking at, having employers stop asking for sick notes for things like that, because that is adding to the burden upon our existing family physicians and creating, more burnout. So it's this vicious cycle.
Yeah.
And so, we need to make environments in which family doctors want to work. And that's not just, from their workload, but also the environment or the setting. So, creating infrastructure that works for our new breed of physicians. Things are changing.
Yeah.
And so, healthcare has not kept up with the pace of change that's happened with society.
Yeah.
Bulk of physicians now are females. And so now we need to deal with that. We need to deal with maternity leave and coverage for them and their child rearing age. We need to find employment for their spouses.
Yeah.
And so, that's another challenge as well, is finding meaningful employment. And, the chamber helps me with that. And I'm super grateful for that. So.
Now, we've chatted before that, this position was kind of pitched as doctor recruitment, but you pushed back a little bit, and now you're a healthcare advancement coordinator.
Yeah.
And because it's not simply doctors, maybe you can explain a bit about what your role is and how that all fits in.
Sure. Yeah. I truly feel that, first of all, I bring 28 years of healthcare experience. So that is kind of the impetus for that, because I have a lot of connections and a lot of experience in healthcare. And so I did see the opportunity to lobby for change and to create, to help the municipalities understand the complex health system, because traditionally they haven't been in the health business and they haven't had to pay much attention to it. So I see myself helping to educate the communities about what are their options, to help engage the communities and lobbying for better healthcare, for looking at other solutions beyond a primary care physician, such as a nurse practitioner, working with the CHC. So it is broader than just physician recruitment. That is, of course, one very, very important component of my job. But in order to have physicians, I need infrastructure. And so, and I also need data. So right now I'm working on gathering data on who lives within Peterborough County and is looking for a primary care physician closer to home or doesn't have a doctor at all. And so that list has been successful. It's been out for about a month. People can find it at the Peterborough County website under Your Health Matters. And it's a simple form. And this data is going to help me to recruit properly, to put physicians where they are actually needed, to look at where we need the infrastructure, and to help a physician build their practice when they come, because a physician doesn't get paid until they have patients. And so it's serving multiple purposes. So if you are in the county and you haven't filled it out, please do so. I'm up to 4,000 already. Okay. So it's going well. Good.
And I've seen your presentations before, and we don't have time for the whole, 15-minute explanation of all, but what, in sort of a quick summary, what is the local plan right now for building up more of that healthcare infrastructure?
Yeah, so the first thing, as I just mentioned, was the data. And then from that, looking at, we do need facilities. We currently have zero space. I am recruiting for one physician at the Morton Health Center, but that's a replacement of a physician who is retiring. So there is no new infrastructure. So these communities have grown by 10,000 people. Other than Norwood Asphodel, there's no buildings. So to me, that is the first priority. And then secondly, it's looking at international recruitment and how to, our local pool of physicians is small, and meaning Canada. Only 1,700 people graduate from family medicine annually, and probably only a third of those go into family practice, and that's for the entire country.
Yeah.
So we do need to expand our pool of applicants, and so we're looking at joining forces with other physician recruiters in Eastern Ontario and promoting our area as a whole, with the understanding that if a physician comes to Eastern Ontario, we all win. They bring two friends, and they bring two friends, and it grows from there.
Yeah. And so as far as the bottlenecks to it, you touched on there's only so many who graduate. What are some of the other aspects that have led to this overall shortage across the country?
Well, I think we're having a tsunami of physicians who are going to be retiring. So the whole baby boomer thing, and we knew about this for a long time, and nothing, they didn't increase med school spots accordingly. We also have the general population who is getting sicker and requiring more care. Okay. Therefore, the care is more complex. And then lastly, the profession of family medicine has changed in that People want to do more than just that. So they want to also do hospitalist work or palliative care, or so finding someone who wants to do full-time family medicine is rare now, where that used to be people would go into family medicine, they'd be a family doctor for 30, 40 years and see people cradle to grave. So that whole work-life balance has changed. The whole, our workforce has changed, and then the family physician compensation has not kept up to the complexity of the work that they're doing. So, again, our government, I feel, is disrespecting the profession and not giving it its due. And so, that word travels, and so less and less people are choosing family medicine as a profession.
No, fair enough. All right, I'm going to wrap up with one question here. What's at the top of your wish list? What's the one thing that you really, whenever you meet with people, that's the top of that conversation that you'd just like to accomplish right off the bat if you can?
Well, you know what? I think that I can't do this by myself, and I do need the community, and I need the leaders within the 8 townships and those people that have influence to be always promoting Peterborough County as a wonderful place for a family physician to set up practice and to be talking us up. And, like I said, I can't do it alone, and I'm going to need people's help to integrate these physicians when they come and make sure they're welcome. So really just letting people know that I'm here and that I need your help. So let's all work together and make sure that every single person in Peterborough County has access to primary care.
All right. No, that sounds great. I'm happy to help as well.
Thank you.
When I came to this community, I didn't think I was going to be here for what is it now, like 16 years.
Yeah, it's a great place.
I fell in love, and hopefully we can have the same effect with some of these physicians and other healthcare professionals and attract them here. So thanks so much for joining me, Lori. Thanks for Bennett's for hosting us in this beautiful spot, and Janice at Odixki Media for producing this. Thanks so much.
Thank you so much, Joel.